Okay.
Good morning.
Good morning.
Thank you for attending. Peter Campbell will not be here. He has an annual investment meeting in New York, sends his apologies. My name is Harrison Pierce. I'm the chairman of Health and Human Services. We do have a very busy agenda today, so we'll go through the minutes, reports, whole business, and then we are having a guest speaker from Catholic Charities, and then the biggest issue on the agenda is the grant request, which we'll deal with after that. So the approval of the October 5th minutes, any questions, corrections?
Move to accept.
Second. All in favor?
Yeah.
Thank you, Alyssa.
Anytime.
Good job.
We'll all rise.
Reports, Health Department.
Jen Ileson, Director of Health. So first, we launched yesterday, Open Jobs, so we're very excited about that. I do want to thank Chris Kaiser, our IT Director, for being co-project manager and helping me along the whole process. And also Brian and Scott from the building department, they really came along at the end. So far, so good. A few kinks we had to work out yesterday, but other than that, everything's going well. Skin cancer clinic, we held that at Irwin. We had 25 people, it was full. We only had 25 slots. I want to thank Dr. L. DeMole for providing that free service to our New Canaan residents. And also thank Anna Kolakowski and Butch and Shannon and her dad for building the booths that weekend. So we took the vaccination booths and doubled them up, so they had ample room to get undressed. Some people wanted a full body check, some just, spot areas, but it worked out very well. We used our one part. So we're already in talks to do it again. So maybe sometime in the spring, so it went so well. So that's great. Our diabetes blood glucose screenings are still going well at Lapham every week. We're averaging around 10 to 15 people. We also now will be adding schoolhouse apartments into the blood sugar screenings, doing them monthly. The weekly coffee talks on Friday at Lapham are also going well. This week's is canceled because most of them are going on some New York trip, but next week's topic is mental health, how socialization increases longevity. The seniors really seem to be enjoying Shannon and my nurse Ellen. So that's great news. Vaccination updates, flu is going along great. You have all the numbers in the report. COVID, we're only doing, as we said numerous times before, the age 6 months to 18. And that has been very low, which is in line with the national trend of that age group with COVID. Grant contracts, we got the workforce development and immunization one. They go before the BOS on November 8th. Once approved by BOS, then Kevin could sign them and the contracts will be fully executed. The workforce development one, that money will be front loaded and check cut as soon as we get the approval, so that's great. Our budgets, we've all have to submit by next Friday. Mine's been submitted. There's no big thing for me, no capital this year and only minor little increases. So hopefully there's no issues with the budget this year. And then just a last note, these reports I also added to our health department page on the left-hand column, Health and Human Service reports. It goes all the way back to May of 2022. But when we started it, the other one to look for the archives. And we also added the OpenGov link to the health page as well. And that's it. Harrison only gave me a couple minutes. So.
Good job. I think looking at it, one thing is noteworthy, and Russ mentioned it, 4 transfers from the hospital, COVID positive testing, whatever, recently. The 214 hospitalizations from COVID in Connecticut last week. So it's, it's not, even though the numbers are way down, it's not bad. Thank you, Jen.
Can I just ask one question?
Even no questions were allowed.
You mentioned daycare, to do daycare, I think that you were looking at.
No, those were inspections.
Oh, just.
So by statute, OEC, before they can relicense, the health department has to inspect them every 2 years, even though we don't actually license them.
Kind of hoping there was some.
No, unfortunately, it is a big demand, but
Harrison, on that point though, it's about hospitalizations for COVID. Are there any deaths?
I don't know.
My family friend died last week of COVID, so there's definitely some deaths. 60.
I would say, it's, they are listing how many hospitalizations, but no mortalities. And as I mentioned to Harrison earlier, we accepted 4 admissions from local hospitals with people that were active COVID, but the symptoms are not mild.
But, you know, if the government says annually the 60,000 deaths from seasonal flu. Are people either dying from seasonal flu or dying from COVID?
We have not seen any mortality rates on the flu, at all.
That happens every year. The government says. The numbers are kind of staggering. I assume it's people in nursing
COVID
homes.
today has been much higher.
No,
People
people don't die of the flu in nursing home?
We zero mortality for COVID or flu in our home.
Are those 4 people isolated that you let in?
They're in administration. No, we have them in isolation units. Yes. Yes.
Good job. Bethany.
Hi, Beth.
Services Department.
Yeah, Bethany Zarro, Director of Human Services. Budget season's beginning. Jen and I will do our Health and Human Service routine. Looking forward to it. And then your grant request submissions, which we will go over later today. The holiday public service announcements campaign we are getting the same pricing from New Canaanite as well as the New Canaan Advertiser as we did last year. I have not heard from the Sentinel. I did an outreach, but just keeping the same prices. We will run the same format unless somebody else wants to do another type of campaign. This is the first year we put out this one for last year, so thinking this year still appears updated and new, but if you have any questions or concerns, let me know. Choices Counseling, the Medicare open enrollment Part D appointments started. Marcy and I are doing those for January 1st, new Medicare Plan D. For those 65 and older, we had a very successful employee wellness fair. Thanks to Jen for doing the flu shots, the health department. It was fun. It's always fun doing it. We will do this. We historically do this every couple of years. We might do it in the spring instead of do it 18 months. We'll talk. And then bereavement group, thanks to Waveney and visiting nurses, the aspect of Waveney, Marcy and I completed our training for bereavement, and so we will now be able to offer that, working with Waveney, offering that in town, not just in the Canaan residents, but all residents, but we'll be running programs for that. So thank you, Waveney. We have our guest speaker today, and then the October meetings, very much strong into the behavioral health steering committee, New Canaan Urgent Assessment Program, the Behavioral Health Alliance moving forward and looking into ways to have a web page giving residents a way to start navigating the behavioral health and have access to speaking to somebody personally. Not just Googling everything and trying to figure out a personal roadmap. So we're doing a lot in terms of getting out to the community, and the New Canaan Community Foundation is definitely a player in that as well. Let me see, we are doing schoolhouse, the elevator. What had ceremony came, and there's a new elevator at schoolhouse right now, which was definitely needed. You could not fit, EMS could not fit a gurney into the elevator before. And so it's going down the old school stairs. This is just phenomenal and ADA compliant. So we're happy about that. And Newtown Human Services is looking to open a behavioral health alliance to start that. So I've been working with them as well with Silver Hill and helping them navigate. And then Women Empowering Women, that was a great breakfast, that was yesterday, and we do utilize that agency organization very much when we're doing resourcing for people that are coming in, women needing help in a number of areas.
What was the breakfast?
It was an awareness of Women Empowering Women Institute, and they have been open now for 2 years. It was obviously, to raise funds and awareness, as well as letting everybody know what they have done the past couple of years. It's very impressive. And they are spot on in terms of what is needed for these women to move ahead and to gain confidence. And the budgeting, the financial budgeting is a huge one.
And they're one of your recommended funds that you want to fund.
Yeah, they are one of the recommended ones, and they do the classes are full. And people stay in these classes for the DBT, the dialectal behavioral therapy, which is a type of changing the mind neurologically as well as mind. Referrals, they continue between Jackie, Marcy, and myself. It's just phenomenal, the resources that we're learning about and giving out, and people are, having a more positive outcome, whatever their situations
I
are.
just want to say that I've heard from our friends in Newtown several times. They met with Bethany after they came down for the visit. And they're looking for how to organize the health and human service operation. We talked about it before, but they are unbelievably impressed with how Bethany and the town works its network of other nonprofits. And so when we're talking about budgets, we'll come back and touch this again, but that's what makes Bethany's world go round.
But that's what makes New Canaan unique. Or not.
Well, that's true, too.
I don't think any other town has
It's
kind of
incredible.
volunteer nonprofits.
That's correct.
That's great, and the nonprofits outside of New Canaan, we are part of their catchment area. And we utilize them, we do utilize them, people need help and they're there, so it's definitely creating a smaller disparity between needing help and getting help. So evictions, we had one large eviction last month, that was a couple of thousand, we had one this month, and that's gonna be. So, but we do have budgeted for the payment of the storage, moving, unmoving, everything like that, even a car. So it's just,
I'm looking for a car.
you know what's coming. And then we continue the blood pressure clinics and. There is more for sale, 500, you can have it. So, the caseload, once again, they continue with energy assistance. We've gone way beyond what we did last year, and the state is doing, paying a lot of grants out, awards to the clients, and they do go through them, and we will end up probably the end of winter, beginning spring, that will go into our own coffers to help the people finish up the season, keeping their heat on. And then the last thing, to a couple of things, the food pantry, we have surpassed any numbers historically in October. 111 people were served last month, which is a height. I think in June we had 108 with 62 shoppers. This month we had 111 with 76 shoppers, and Jackie just added 2 more families for the next one.
Any sense of what's driving the increase? Is it awareness or need or?
It is more for people moving into the community with affordable housing.
Okay,
And they do qualify for state programs as well as our programs. And last year, the people moving into Canaan Parish, their energy was included in their rent. This is the first season where it's not. So where people are coming up having to pay these bills and they're falling short. And so we definitely encourage them to utilize the food pantry, because we do offer things that Most likely they're on SNAP as well, but we also offer non-SNAP paper products, diapers, toothbrush, toothpaste, things like that are expensive. So it's just, the community is unbelievable. Our donations continue to come in and to support this part of the community. And then we have the New Canaan Urgent Assessment Program. It continues. We had a meeting this week with the behavioral health, and Susanna Lewis, who is the community outreach director for Silver Hill, she went through the assessment program update, which I've included. And just for those watching, the total cases since July 7th have been 148 cases since it was launched. It's July 7th, 2022. Weston has come on now, and they are filling their spaces each week. And so we are just working with them, as well as getting out and loving to, would be great to have another community join us, which we're working on.
The census at Silver Hill for the urban assessment is about 10 per month, averaging with decreases and increases. So, and this has been consistent going into this year too. So ideally, they'd be busier. I think they're looking to connect with other towns, and hopefully that will supply some numbers. It has been marketed pretty well, but as they mentioned at the meeting the other day, one of the nurse practitioners in town, deals with the behavioral therapy, knew nothing about the Silver Hill program, so that would be a surprise. So, things fall through the cracks. The cost per evaluation used to be $1,200, $1,250, it's down to $950 now. They've pared it down some for those that can't afford it.
Yeah, that was.
New Canaan is still.
Not for those,
Yeah,
not for those who can't afford it locally, because it's free for the Canaan resident.
Right.
But for there were like 7, 8 other towns that had people show up.
Yeah, so they're in New York, New Jersey, and towns in Connecticut. So it was good to know. At one point it was $1,200 to $1,500. Now it's down to $950 after their fixed costs and everything.
About 85% of what they see is kidding.
Could I ask a question?
Yes.
Medicare Part D, you and Marcy are doing subsidized?
Right, so what happens is at Lapham, obviously, they have hundreds of people coming in. When there is a Medicaid, Medicare savings program issue, they come to Marcy.
How many do you serve?
Well, everybody, most of our clients, well, I bet we go through 30 or 40 a season.
But there's hundreds that are served by the volunteers. That got incentives.
Yeah, they're just
I'd say it's hundreds of thousands of dollars.
hundreds of thousands.
Every senior should go every year.
Yeah.
Because the insurance companies. Yeah.
Yeah, but didn't you used to do
I used to do it, yeah. I may go back to doing it.
it? What else? That's it. Yes, and many of our clients are with their programs that they're on. Most often there is a program, Part D, that's chosen for them.
Right.
But then what happens, there's some drug issues, things like that, and explanation of the benefits. They're, worried. They don't want to lose this. They want to keep on their medicine, and they just, so it's more verification.
I would add that Medicare managed care plans and the difference between them and your drug regimen, your physician regimen. I mean, that would be a great educational program for seniors as well, understanding the difference when they sign up for a plan, because each one is completely different. United is completely different from any others, and so that would be a great educational program.
You're talking about Advantage plans.
Medicare Advantage plans.
Which takes it out of, not Connecticut has relatively few people that take the Advantage plans.
Yes.
And I read an article the other day about,
Well,
they're-
providers, very, very few
Providers.
providers take them, but now we're up to, Fairfield County is up to 62%. People over the age of 65 are in a Medicare Advantage plan. It has made a huge enrollment
Of the whole population or
of the whole, the over 65 population,
Wow.
Medicare Advantage, 62%.
And Russ, do you think that is, my feeling is, and maybe correct me, you work more with it than I do. They offer eye exams, hearing,
Dental.
things that Medicare does not cover under original Medicare. And
But
so
what happens if you enroll in there and your provider isn't there, then you won't be accepted. So, if you look at post-acute care, I'll just take United as an example, there's probably only 3 or 4 places that you can go for post-acute care if you sign up for, the Advantage program for under United. So it's those types of things, understanding that your provider, your physician, your healthcare provider, therapy provider, whatever that might be, that may not be included.
some people want to stick with their doctors, others are
The other-
willing.
They're given the reputation of turning down care, which is, is turning people off to the plans.
Well, when, a lot of them pay Medicaid rates. And then, as you know, Medicaid is well below the provider's cost, so it's very difficult for them to sign up.
Is Stanford and Norwalk Hospital participating, because that's part of the reason that we signed up locally. They weren't accepting Advantage.
Well, I will, for any of you that's trying to renew your health insurance plans right now, the costs have gone up about 25%
Yeah.
year over year.
Hmm.
My theory is that the hospitals are standing tall and are, really negotiating better rates for Medicare Advantage, and that's driving up the cost for,
And that drives up the number of people.
It does.
Okay.
it does, all the above.
The number of people though in Canada that use Advantage plans is very small, because the middle class affluent people don't find Advantage plans to be, they're kind of clinic based.
If they want their own doctors.
They want their own doctors.
They've had.
So,
Well, we have, we could get, it's an hour-long discussion, we get into the use of concierge physicians and New Canaan. And that's taken away a lot of business, a lot of issues for people, but we still see a significant population of New Canaanites coming to us for care that are under an Advantage plan, significant.
That's it for me. Any questions?
The only thing briefly. This discussion at the meeting in Silver Hill about doing a survey of mental health issues in Canaan. I think Kevin was in favor of doing something like that. Warren Patterson with the Canaan Community Foundation in favor of it. Bethany, I think, is in favor of it. I don't know what people's experience with surveys. There's a X number of experiences at hospitals and from local and club type things. They have been pretty unrewarding and people have considered come away with time, money, et cetera. It's complicated, but it's out there and it's being discussed. So, and Kevin, you had some.
well, the interesting conversation the other day, New Canaan did it about 10 years ago, 12 years ago, 14 years ago, and
2010.
we haven't done it since because it was being done through the Board of Ed. And it was, people didn't like the results, so we haven't done it since.
We like to hide our problems.
Anyway, we'll see what the future brings. Full business holiday announcement that Bethany referred to with this, is we do it every year, it's to make people aware of the alcohol, driving, substance abuse, holidays, et cetera. And it's also a little marketing for HHS. And so we're going to Canaanite, the advertiser, and they'll be in before Thanksgiving, a week before, 3 weeks during December, correct? And
It'll be the month of November. I'm sorry, the Thanksgiving to New Year's. So it's 5 to 6 weeks depending on.
I wanna make a recommendation or proposal that, in addition to that, that the commission write a letter, compose a letter that talks about all the things that Human Services and Health Department do over the course of the year, and just some numbers. I think we've all talked about how there isn't so much awareness of everything that we do, and I think when you talk about the food pantry and the vaccinations and all the different things, that it might be nice just to help communicate at this time of holidays, and say, here's what we've done this year.
Yeah, make a letter to the editor.
Something, yeah, does that resonate with anyone?
I think it's good, but we popped on this is not on the agenda because it arrived yesterday. But,
Yes, well,
so
because I read your minutes.
the last meeting that the commission wanted, please thank the stewards for what they did with the food pantry donations, et cetera. So going public with it, I think Barb wrote it to the personal note. Bethany had already done this. I thought it was going to the public like we've done before, so I did formalize it. So it's out there, but that in a way says not everything that the Health and Human Services does, but most of what they do.
Mhm.
And so if you put that in the paper and the advertiser of New Canaanite, then people will get a, little mix of it, plus you get the holiday thing. People are aware of us and what we do.
Should the letter talk about what we've done with lovers and stuff, or what we can do to help you? Or it could be both. It should be a notice to people that we're here to help you. We help in all these different areas. As opposed to just saying how much good stuff we did last year.
Yeah, don't just come to us when your hair is on fire.
Right. We're here.
Well,
Okay, so what do we think? Should we go forward and?
Draft something, I could draft something,
Yeah.
and then you could say
Yeah.
whether you think it's good.
Yeah, no, I can put it.
Look, I think it depends how it's written,
Right.
right? I mean,
Right.
that I think is going to be long. We did do something similar,
Wow.
last year, right? And right, I don't think we didn't see a dramatic increase in calls or response rates or anything
Right.
of that nature. But I would recommend we maybe just talk about the services or, here's the phone number you call during the holidays.
Yeah.
It's not that, people are gonna cut it out of the newspaper and say, put it on the refrigerator, but I
Yeah.
think it is worthy around the holidays. It's gonna be a very stressful time for a lot of families.
I mean, do you
This
want,
holiday season.
you can possibly put this for more community resources and help, contact human services, or do you want?
Well, I think, once we let Art,
Yeah.
Yeah, but that would be absolutely, that's how it ended, yeah.
Yeah.
We can circulate it around and see.
Just find all the services.
After the election, there'll be a need for letters for the editor, I was thinking.
After the election, yeah, just a thought, I just,
Yeah.
when I read these reports, I think, oh my God, look at everything you're doing. And I don't think people recognize.
Good.
The both parts.
need that.
Next item, under all business, the opioid settlement. So we have money coming and gone back and forth. What do we have? What don't we have? When's it coming? Kevin, can you update us?
I think, well, I sort of missed this and I should have attended your meeting last month or at least read the minutes. Cause I think what you're recommending $78,000 total recommendations,
Yes,
plus the internal department request and
which are minimal.
police, which are small. But I think now that I understand what's going on here, we ought to have the board of selectmen approve this next Wednesday,
Next Wednesday.
so that your recommendations are fine with me.
Yeah, I think they're good recommendations. We've all gone over this. Right. And so then I think we can just drop the real. Add the money to Lambert, et cetera, thinking we can get some of this. I mean, we were thinking about.
Right.
Health and Human Services giving a donation of like.
If we don't have to.
We don't have to, yeah.
Because we are eviction for so long.
Is real,
Well, I think the opioid money is the appropriate funding for that.
but is real for profit or nonprofit?
It's a for-profit. It's
Right now,
for-profit just because there were investments, you got a kickstart, and they will get some money back, so it's mostly.
So you're really subscribing to a for-profit service.
so we are subscribing for the town residents.
Yeah.
This is how it's. being-
Ideally, the board of ed would do it, because it's kind of directed for the parents of school children and stuff.
Well, here's the thing, I think the Board of Ed has had an opportunity to do that, I think people have reached out to them and asked them.
Yeah.
I think, where they were offering, was one license fee, one for the entire town.
Right.
And if you called Health and Human Services, you got that license and code, and you'd go on and use it, so it was, even though they were for profit, I mean, what they were offering is one code for the entire community.
So that's why the town would pay for the licensing
Yeah.
on a monthly basis. Silver Hill is in on it. I mean, it's just consistent with, if you look on their website, who
Silver Hill's licensed as well.
is licensed as well. It just creates a
It's
continuity.
$6,000 per year.
Well, I thought it was,
500 a month. We could do every 6 months.
We just thought if we didn't,
18,000.
if we didn't get the funding from.
They were looking at 3 years.
3 year subscription.
Yeah,
Yes.
3-year license.
Well, actually, this probably should be in your annual budget, 8,000, 6,000 a year rather than $18,000 one time. Oh, you have to pay up front for 3 years?
Well,
No, but this is for the opioid, we can't,
if we
we
get
have
the
to-
opioid settlement, that will pay.
this is for the opioid settlement, this is.
I'm confused now. Are we gonna do this or what's the alternative?
I think right now we're gonna wait for the opioid settlement to see what we get, when we get it.
And then if you don't,
And then if we don't, we can come back and HHS can either. We
Put a
have
grant.
6,000 plus.
normally there's nonprofits, that's my problem with doing this under the grant process. It's not a.
We probably kickstarted with $100,000. Okay, thank you. On to new business.
I remember we had Catholic Charities, one of our grant presenters, and they're here today, Christine. Is here along with others, and you can introduce them and please sit up here.
I hope it-
So this is our Health and Human Services Commission. And you just, do your thing, and I'm sure they'll have questions. So hi, everyone, my name is Kimberly.
You know what, why don't you sit here because we don't know how to.
Okay, I'll do it.
So hi, everyone. My name is Christine. I am. Alright, so hi, everyone. Hi. So my name is Christina. I'm with Catholic Charities. I oversee the community advocacy program, so the flyers going around. And I have with me my supervisor, Heather Ely, and one of the top interns, Maggie. So just to give you an idea of what my program does, is we're like the 2-on-1 of Catholic Charities. So when somebody calls and is like, I don't know what to do, and you guys are the Catholic agency, you offer a lot of charity, so we just don't know what to do, where to go. So myself or Maggie, who will make the call, will do an assessment to see what's going on, kind of investigate the situation. Sometimes they need help with applying for benefits. Sometimes they need help calling 211. Sometimes they need help finding food resources. It really kind of depends on what's going on. So just to give you an idea, we can do short-term case management. We just actually recently helped somebody who was a New Canaan resident as they needed help with background. Luckily enough, we didn't have to help them. They were able to get the funds, but we provided them with that case management, helping us apply for different benefits and also just figuring out what they may need moving forward. So that's just one thing. We do a lot of SNAP, Husky, WIC, helping them apply for those. SNAP is food stamps, Husky is health insurance, WIC is cash assistance. And then we also help them with other resources, so like utility assistance, Alliance and Community Action provide those. So we work very closely with them and contacting those agencies and working together. Sometimes we get financial assistance to help them with like back rent, security deposits. So that's one thing that we're working on trying to continue to help clients with. Right now, we're hoping to apply for more grants to get more money to help more people. CAP program does do all of Fairfield County. So we try our best to help everybody out, even if it's a small amount, then we'll go reach out to person, again, Community Action Alliance to see how we can help. And then we do have a furniture program that we refer a lot of people to, and then clothing referrals again as well. And then we do a lot of advocating and if they need help speaking to the landlord, speaking to an attorney or whatever it may be, we do help them with that as well.
So one of the things that is really cool about our program is with the Catholic Charities, just over at our office in Norwalk, we have a lot of resources. We have immigration, we have mental health counseling. We have a loan program where people who have poor credit can apply for a low interest loan to build their own credit and to be able to buy a car, pay tuition, whatever it is. What happens with CAP is we have all these great things. People don't think to call us because they need, immigration help. But when Christine or Maggie is screening these people and talking about what they need, we have resources within our agency that we can refer them to. And then Christine has built amazing relationships with people outside of our agency so that we do a lot of that intensive or initial case management, like what's going on? And then how can we help you? We've been really fortunate. We got last year a $90,000 grant from the Gerstner Foundation through Catholic Charities USA.
what's interesting about these grants we get is people want to give us money to help people, but nobody wants to support the administration that goes into helping people. So they're like, here's all the criteria of the grant. What's really great about our grants is it's about sustainability. They don't want to put a Band-Aid on things. All the money we have right now is, if we help, will you be sustainable going forward? So Christine and Maggie work really closely on assessing that and figuring out how to make people sustainable going forward. And then we have this great pool of money that we can help people with, but we don't have any money that supports us in the process of doing that. So that's something we're really kind of seeking, is that support to be able, the financial support to continue to provide.
Can you give us an idea of the funding sources that you're getting? What percentage are grants, what percentage, come from major donors, can you give us an
I
idea?
can probably do that.
Sure. Okay.
So as far as admin, we have one private funder who covers about right now. Oh, so I want to say 30% of the budget, and the rest were, the other donors are all for support that go directly to the clients. So Catholic Charities is, that program is operating at a really big deficit in order to provide this service. This year, our hope is that so far we've gotten, 160,000 for fiscal year 23. Some of it carries over, it's hard. Like, this what grant came in October, and it's for this, that 12-month period. But we got a $90,000 grant from Catholic Charities USA. Somebody just gave us a $50,000, a donor to provide support. But again, that's all for supporting the clients that come in. As far as supporting administration, we have a private donor who gave us something that covers that 30% of the budget.
What's your total budget for?
Oh my gosh, I don't have it in front, the total budget for Catholic Charities
Yeah,
or
In
for,
Fairfield County,
Or-
are you Fairfield County or just lower Fairfield County?
we're Catholic Charities of Fairfield County.
Right, so what's your total budget?
Oh, we're in like 13 million, I wanna
That's
say.
why, people don't realize the scope of.
Yeah, right.
I was just gonna say, I did a lot of work with them in the last 6
Yeah.
months, and, I made a presentation at Merton
Yeah.
ago. And I'm thinking they feed 250 people there per meal
Yeah,
every day. And then, we talked to the Norwalk, Center.
mhm.
They have a huge number of people that again, you never think about these little things that get done. Yes, somebody that knows about it.
Catholic Charities is the largest social service agency in the United States outside of government.
Yeah, but my point is also, you get money from the federal government and the state budget.
So some of our programs, the ones in Norwalk
Yeah.
that I oversee, we don't have, well, that's not true. Our counseling program got ARPA money last year.
Right.
But then we have housing programs that are funded by state, so we have, ARPA dollars through that. We have money through the Department of Mental Health and Addiction Services.
So a significant part of your budget is coming from the government, federal or state.
Yep, so we have federal, state, private grants and donors.
So I just wanted to say, they, Catholic Charities, when we have somebody come in and they're in need of some type of financial, mental health, so many things, and very often we say, well, have you spoken to Catholic Charities? And they go, well, I'm not Catholic. And so that is what we're also changing too.
It
You
is.
don't have to be a faith-based specifically to receive help. And we have the caseworkers, they come to New Canaan. I mean, this is where the fees are coming, and they're coming in. And we do try to pool money together, as when you said, the sustainability of a person, we want to empower them, not just to keep them in one place for a month. We want to empower them, and that creates a lot of resources that need to be taken in and utilized. And so this is when Catholic Charities, person to person, there's so many, and human services itself, we can pull our money. At the same time, it is the administration and the staff that we have, just like human services, we have donations coming in for people in need, but the staff itself, the designation is not really always towards the staff, and keeping staff that knows what's going on and not having to train them year after year, but keeping the longevity of their jobs.
Yeah.
So that's what we're here to promote human services and advocating for the resources. So,
Do you have any idea how many people came in, need help from you?
Yeah, we try to keep track of it. I'll be honest, last year it was minimal. I think we tracked 10 people that we provided support to. One of the things we wrote in our application is we would like to work more closely, because not just for CAT, but just to promote the services we have and make sure our mental health, we offer counseling, we have evening hours, virtual, in-person, French, Portuguese, Spanish, and English counselors. Like, we have a lot out there, so we wanted to work more closely to come in and get something going on where we can present. We've got our counseling flyers, our CAT flyers for you guys. But, yeah.
I have a question. This is amazing what you do, and I know how valuable it is for Bethany. I was here one day and somebody was sitting down with a child, and you just said it was just so invaluable. You mentioned in your application that you, are gonna try and do 2 presentations in New Canaan. Do you have any thoughts on how that's gonna be logistic for that, or outreach?
So what we've done in the past for things like that is we're like, okay, we're gonna go to the library, or we'll go to a food pantry, somewhere where we're there. We'd also love to work with you guys. If you were like, something's going on here tonight, can you guys be here for a half an hour and just talk about what you do? Very open to kind of working as a team and making that happen in a place where it's effective. Like, we're like, oh, we went to your library, but people aren't using the library, that's not helpful. So I think we would probably be reaching out to you for some guidance as to where it makes most sense for us to do that.
Great, great.
I think there are 2 senior people at Catholic Charities that live in New Canaan.
Yeah, Angela, and who's the other?
Mike,
Mike's in New Canaan?
I thought he lived in New Canaan. I see him in New Canaan, but he's probably raising money. out
Yeah.
there.
That'd be 2 staff. 2 staff.
So Mike, our executive director, I believe he's Darien, and Angela Piscatella is our new chief program officer, and she's from Michigan. That's great.
He's in Darien, all through the day.
Well, it's sort of a suburb of New Canaan.
Though we have to know that. You're also, as I recall, and correct me if I'm wrong, working with some Ukrainian families that were trying to relocate into the area. Do you have any, can you tell us
So
anything about
I think it
that?
was more the Thomas Merton Center.
I believe you're correct. Our immigration program, we're actually working really closely now with PET, Partners to End Human Trafficking. We just got a grant, subcontract with them. We do a lot, mostly, we do a lot of like, all the different applications are escaping me the names of them, but what we do in that program is typically somebody comes in, it's a $60 consultation fee, but we have 2 partially accredited DOJ representatives, so they can provide legal advice. And what's invaluable about our immigration service is, I can't tell you how many people come in and say, oh, I need $495 because my lawyer said if I put in this application, I can work. And people aren't getting good advice. So they get the money, they put in the application, and they're not eligible for it. Our DOJ reps will sit down and talk to people and say, okay, I'm listening to your circumstances. Let me ask these questions. Do you have a path to be here or not? So the Ukrainian refugees, a lot of them have a path because we have things set up right now available to them. We haven't seen many of them in Norwalk. We're dealing primarily with people who have come in and said, I need a green card, I need working papers, I'm trying to apply for a U visa or a T visa, and then we try to help them all.
And also keep in mind that many of the people that work in New Canaan come and they're surrounding towns, and we don't have access to that, but it does help them coming to New Canaan and working and holding down a job and having their kids, remain in the school systems around us. So it comes in from other aspects as well. Any other questions? We're just grateful for you and the ease, the user-friendly aspect of it. And I just thought it was important that you came in today and just, it's always important to see a face with a resource.
I have another question, though. Excuse me. Do you have any sense of what other towns and cities do as far as giving you money, grants, or?
We don't get, to the best of my knowledge, at least for Norwalk, we don't have any other grants that are coming from local towns that we've applied for. We've done, we applied and received a grant from the Elizabeth Ambler Foundation. We had grants at our preschool from from foundations like Portsman, and then they get federal funding because we're a school readiness program.
The city of Norwalk provides some funding for Winter Grove.
Yeah.
Thank you for all you do and the charity that provide. It's a great resource. And, on behalf of the entire commission, thank you so much for taking care of so many people. And the
Very
service you
impressed with
provide.
the years of breadth of what you're doing.
Absolutely.
Well, thank you for listening to us.
Thank you for coming and informing us.
Yeah.
If it's okay, these are some of our outlook, our counseling.
Yeah.
Okay, great. And just to your point about him saying, we rebranded our entire counseling program because people thought you had to be Catholic. So we went from Catholic Charities, behavioral health to New Outlook Counseling, a program of Catholic Charities.
We have employers in the area that would like to offer jobs and positions and reach out to people, which of these numbers should they call?
I'm sorry, if you had somebody.
If someone that comes into Catholic Charities, they need a job, they need help, they need DOL supporters or things of that nature.
They always start with CAP.
Always.
Everything,
So the
and some,
number
yeah.
right at the bottom. You'll get our front end person, so it's the 203.
Oh, okay, got it.
And then also if you, the UR code on there,
Right.
if you scan that, it brings you right to our webpage where you can make an appointment to talk to somebody.
Okay.
Or have them call you with services.
That's right.
One question, how much do you give to your change your religion?
You're the ones who get too low. The lower it's too slow.
Thank you so much. Yeah.
Let's admit it, like Harrison. Already.
I have one other.
Keep that one.
Yeah, one other new business, Vicky. Yes. I wanted to recognize as a commission, the way that the telemed program is winning a statewide contest of showing that we are out there on the edge again. So I wanted to congratulate you officially, and I don't think we need a motion, but certainly you need to recognize that. We're on the edge of innovation.
Well, this year we won for the state, the Spirit of Innovation Award, a lot to do with our ARPA funds that came from the town, and Kevin, and a lot to do with this commission and you, Jen. So a lot of people participating in the program that got it up and won the award for the entire state, so.
Congrats.
That's right. Oh, further, yeah, that's.
Very good.
Melissa has that in minutes.
All of them.
Okay, so. That was But last item under new business, the grant requests. That's, so you did get the enclosure correct. That thing is done, and it's got down over, and hopefully you will last got it anyway. And let's,
Beth, did you bring me a printout at all, by any chance?
For the.
Yeah, that's.
Which pronouns do you want?
No, just the summation of the grant request.
Yeah.
Oh, do you have one? No, I can share with Jim.
Right. That's.
It's okay. Oh, thank you.
right, under the grant application request, so. You see them all listed, you see the numbers. We'll start with Catholic Charities, you have that in front of you. So the request was 12,500. Approved last year, 2,500. Request this year, 7,500. Director's recommendation, 2,500. How do we feel about that number? Is it good for community dues?
I know, Jim, you had a great term. It is
Did I understand from her answer that really only town that gives them money?
Well, I think Norwalk sponsors one of their programs, but
Yeah.
probably doesn't
Other
sponsor
than
them.
their hometown.
Yeah, yeah. I was, look, I defer to Bethany in terms of how many calls that she gets and refers to Catholic charities, but if their number was 10 New Canaanites, so 10 New Canaanites, that seems like a reasonable donation to give, unless you feel that it's more than that.
I think it's good, and as the woman that was sitting here, can't remember her name, I just know Christine. Heather. So, the administration costs.
Yeah.
They're coming to.
There's dollars, yeah, right, yeah.
Pardon, yeah, they're coming to New Canaan, they're doing this, it is like the price of doing business, I don't know, it's
Yeah, it's
partnering with the area, and I just,
They're important to you.
it's important to, right, human services, whether they call Catholic Charities and reach out and get help, or Catholic Charities is able to help them, when Heather was talking about the sustainability, they're just not giving money out, and we do the same thing, we have to see that there's a plan, help these people make a plan, and then move forward with it, and give them that jump start, but if they're just looking for rent for the month, but have no plans on getting a job, that's not sustainable, we wanna see the
You want
sustainability.
a motion on each of these grants, or you're gonna do it all in one time?
when you look at them all, we love to use more money.
Right.
I mean, Gerstner, I'm pretty sure is a New Canaan person that gave the 90,000 to Catholic Charities, but as they said, this goes for designated purposes and not for funding the staff.
Yeah.
So what I think we're doing with our money is funding the staff.
And I just want to add one more thing, which is, it's probably very true that residents of other communities working who are benefiting from the program.
So, yeah, when speaking to the restaurant workers, things like that, we're grateful for. I think this is what makes the town so great, is they love working here, it's a safe environment, they can take the train and walk across the street to their job at night. So I just, there's a whole invisible aspect that I think the town, we're so fortunate to live here, and if we can pass this around to other towns and people working here, and it's great.
Reading Foundation.
The Community Foundation funds Catholic Charities, yeah, I'm sure it does, yeah. I mean, unless it's changed, but.
All right, so we have a motion to approve the 2,500, just want to wait for the end and then we'll do it.
Let's wait.
Okay.
All right, child guidance. Given us statistics, I got many patients from Canaan or clients, I think it's in the 20s with,
Yeah, and for, there are like 20-30 patients, but they're covering different aspects of what is offered in terms of.
yeah, it's child therapy, it's parental guidance, it's medications, and they also have a 24-hour service. So it's, even though the numbers aren't big, being, I'll say 30 max, the kind of service that you provide is,
Big deal, each of those numbers is a big deal.
Yeah.
when you look at the hours involved.
Yeah. And we talked about this briefly, Bethany, this doesn't, totally different from our own,
Kids in crisis.
kids in crisis.
Right, this is another avenue.
And this is another form of community dues, basically, as far as I'm concerned, that allows us access to Bethany's network.
Yeah.
To get it done.
Yeah, kids in crisis will often refer to.
To child guidance, once again, none of these organizations in the silo. These are this is the community working together within the age range, youth family. As well as the age spectrum, but for child guidance, very, youth family centered.
Okay. So that's 5,000 and definitely recommends going along with that too. Okay, next Community Action Agency, the Western Connecticut.
Now, once again, this is very similar to Catholic Charities in the sense that they do receive government funding. At the same time, they do have their administration coming over and doing casework with individuals in New Canaan. as well as Community Action Agency. They do all the energy assistance for our catchment area, Norwalk, New Canaan. Once again, we have the working community coming in. Many of them do qualify for this, and this takes place. We do use them year round, but they are the center that the state makes them the head for emergency energy assistance and the whole application process.
2,500 is.
Yeah, it's doing business. Once again, it's the administrative costs.
Did they, so it's my understanding that our eviction related costs have gone up.
Yeah.
Is there a sense that if we gave them a little more money, it could be, you know, it could essentially make itself up in fewer evictions or?
No, the eviction process it's way beyond Community Action Agency. This is, yeah. If someone is working with Community Action Agency, the advocacy there is great, but this is legal action putting on by the management companies of rentals and loans. So it's way beyond this for that.
500, that's what we've done in the past. Next, domestic violence crisis center, so we did have the speaker, we've had speakers for most of these.
Yeah.
Requests. They also had a fundraising luncheon, which for our, Lisa, I attended, which was very good. By the way, that book. And it's once I come back.
Yeah.
Really depressing.
Anyway, so, we see the numbers of the domestic violence increasing annually and, you know, COVID related, whatever. So 10,000, we've done that in the past. I guess we'll have to play continuing with that.
Yes, they serve a lot of people, get big footsteps.
Yeah, when we asked them, if you remember from the last presentations, quite a few came the next week.
124.
So
Yeah.
they
Right, so if we only had the police level, which I think we did 35, 40 last year, but they had over 120, 130, so, which is good, we want them to call somebody, if they want to do it confidentially, it's there, it's available.
And when the police screening said 22% are homeless, yeah, a lot of people, a lot of people.
I mean, Harrison, one of the things, that, you know, in just the interest of time, I'm just making a recommendation. If you looked at 1, 2, 3, 4, 5, 6, if you looked at the 6 programs that are really focused on New Canaan, I just did the back of the envelope. I think it came out to 277 of the 299,000. I was looking at domestic violence. I was looking at Get It Out, Kids in Crisis, Meals on Wheels, New Canaan Cares, and Silver Hill Hospital. If you just add those up together, that's, you know, the lion's share of the amount of money we're giving out. If the only question I would have is, with Silver Hill, is that going to be enough, you know, to sustain
So that
them?
that was approved for 2 years and
Okay.
put in our human service budget line item.
Approved for 2 years plan.
Last year, we have approved, it's approved was for 23 and 24 to give 50,000 each year.
By who? They can't approve 2-year budget. Who
I know,
are you referring to now?
I thought it was
Or is that the amount Silver Hill agreed to for the next 2 years?
for the next 2 years.
Maybe that's where it is.
I picked up on the gossip circle somehow that the board of selectmen had approved.
Well, the board's like, can only recommend.
Yeah, it's not.
I think it's about the Board of Finance, you only fund,
It was $100,000, but they had split it for 2 years.
oh, no, the other 50,000 is Board of Ed.
They're giving for 2
Board of
years
Ed
as
is
well.
50, the town's doing 50, but no,
Yeah.
there's no 2-year commitment.
Huh,
But you
don't
just
know where I
can't-
saw that.
Nobody makes a 2-year commitment, right?
Don't I know it?
Well, Yeah, no,
Well, let's not just,
yeah.
Well, you know, this is the-
It's 250.
This is an important issue because so it's Kids in Crisis. It's a sizable increase. We're, as I mentioned,
that's
make a recommendation to picking up.
Yeah, that's.
The slack of the Board of
A
Ed.
little further down the line, but that's the Board of Ed is, with us.
Well, that's a deal that I understood with.
are you talking Silver Hill or are you talking Kids in Crisis?
We have
We're
two
talking
here.
about,
We're talking about,
If Kids in Crisis, there may have been a discussion about 2 years. But problem is the Board of Ed committed to 1 year. And there's been no discussion on the town side about that second year. That's,
okay, 'cause I understood it that the Board of Ed agreed to pay 100,000 for 2 years, and New Canaan did, so we would get 50/50 from each. Don't know what meeting I was at.
As an action, Kevin, if we put it in.
I think this is gonna be the biggest discussion about Board of Finance as to whether, or this is what.
Yeah.
You go from 246 to 299.
Yeah.
And that's mainly Kids in Crisis.
It is.
And,
Yeah.
And,
It's it. Well,
Yeah,
well, but the incremental addition, you got, it's Kids in Crisis and,
get about,
forget about's always there, forget about's always.
no, but we're talking going up,
And literally.
year over year increase.
yeah, 25.
If we didn't do this for the human service budget, for 50 grand for the urgent assessment, where would that come from?
Well, I think the town is committed to the urgent assessment program.
Yeah.
I think Kids in Crisis is the problem because, Board of Ed stepped up for. to
2
take-
years, they agreed, so I talked to,
So
Brian.
we're the second year?
yes, and they've agreed to pay for the second year as they're honoring it.
Half.
But for 24-25, this is,
Yeah, that's why this is gonna be totally new to the Board of Finance,
right,
and they're gonna say, so that.
so when I talked to Brian, he said if we pay
Just up for the record, we're talking Brian Letsey,
Brian Leslie,
okay, superintendent of schools.
right,
Okay.
this was ARPA funds for the past 2 years that he was using.
Right, that's the problem with using our fund, because it's not sustainable.
Right.
Yeah.
Yeah. it's-
Don't I know it?
There's.
So, not going on, he said, so this will be in kind, and he said he will split. If we
But the
can,
town needs much the town to pay for it, but the town.
it pays for it no matter what. That's a lot here. The town, whether it's the Board of Ed or Human Services, we need a kids in crisis counselor at both middle school and high school. I mean, however we want to pay for it,
Dr. Lutzy is very aware of that, needs it very much in favor of it.
it's very, yes,
And he does a much bigger budget, $100 million gets lost, $50,000 gets lost, $100 million.
so this is the thing, I.
That was my only question. My only question, I think, was that you had a $10 million or however many dollar budget that the Board of Ed has. And we're talking about taking, increasing ours at 50,000. How did we want to split that or make the recommendation to split?
Right, and I'm willing to, I want to make it any way possible for the town ultimately pays for it. And if we can put it,
This would be a Board of Finance discussion.
yeah,
No, I understand that.
The question is really,
it's
are they
recommendation.
gonna say you should have a pot that you reallocate or $50,000 increase is a big jump?
To your point, there won't be any more ARPA's. in the lifetime.
Right.
Exactly,
So I think the Board of Ed every year return money to the town,
Well,
right? They have $2.5 million, so, they should be able to put it in their budget, that's why.
That we've had this discussion ever on an annual basis, that the Kids in Crisis budget allows the Board of Education to do an arm's length treatment of kids that need the service.
So there's no question, historically, the 50 price has been done on the town side. Right,
Yeah.
and the community foundation, the other.
Yeah, big questions. Yeah,
So that's this is new ground we're trying to have the town take over. Something that,
But the confidentiality issue continue.
100%.
yeah, I think it's wonderful for human services to have it in their wheelhouse. At the same time, to me, it doesn't matter. I just want to maintain a counselor at each school.
I think we all do.
Yeah.
We all-
So it's how you want, we can fight for the Board of Ed to do it, or we can do half this year, half next year and work with them. I think it's a wonderful, we've never worked with the Board of Ed before, Human Services. So I think it's a great partnership that we are possibly creating. And it was, I had a great discussion with Brian and everybody feels that this is definitely needed.
You know, part of that is, you know, and not to belabor it, but you're going up $50,000 almost, $48,000. Was something, you know, that we all believe as commissioners, I think, that we should be supporting it. But other programs are getting the same amount of money that they did last year, the majority of them. When inflation has gone up dramatically and the cost of some of these programs, that's why I wanted to focus on really the top, you know, 6 that really are, you know, need our support, need our full support behind it. And looking at some inflationary factor of 7% or something like that, because their costs are going up.
You know, but the argument against that though is what the community foundation does. People's cycles, you know, Denver has to be doing very well these days.
Right.
And even though, so you can't look, community foundation every year, what's your numbers this year? And people kind of, inflation has gone up and something, they've gotten very good at their own fundraising.
Donations, yeah.
So you can't look at it just like, well,
Agreed.
Would your council be to do this out, when we get to the new board?
that's for the move.
Well, it's not
This
even.
is the wish list, baby.
Yeah.
It's a wish list. right?
So, you know, my motion is that to keep them all the same, but for those core programs to put an inflator in year over year. You know, you can wish for the moon and put no, that is my motion that I'm putting in because I think it's very important.
Have they actually made the request?
We haven't requested some of the
What?
Has each
PVCC.
agency actually made the request?
Oh, yeah, here's the,
Okay,
yeah,
Yeah.
each one is put in a,
so is Gilbert asked for 47,000?
so they asked for 50.
Okay.
So, yeah, I can give you all these.
Well, I think the request is 65.
They requested 65. Oh, you have that.
I do that, okay, sorry.
Yeah, if you look at the request, it's
They've
24.
asked 55.
Yeah.
Okay.
Yeah, the price of gas has gone up. They've had to buy 2 new vans.
And roads, costs,
Yeah.
separate matter, they're funded. But
That's
not by donation.
And Get About is now under the town.
You know, well, they saved a lot of money, I mean, the town,
Exactly.
so.
Kevin, how would the board of finance look at an increment of?
Well, I think the discussion is gonna be named by 55. And
Yeah.
I think that everybody's been virtually behind, student, if Bernard said, whatever,
Later.
yeah, the other 10 you're adding with the other agencies, kind of around.
So.
Price of doing business.
Don't do it, so it'll become self-sustaining, but there's always gonna be a need for people with no money to get it. So,
Maybe it's Silver Hills contract, 2 years. Do we sign a 2-year contract with them?
We don't.
I gotta sign this now, why I did.
Well, the thing with Silver Hill, I'm hearing that the fees now have gone down.
To 950.
We also like to bring
And
that,
that was actual additional revenue coming in from towns outside of New
you
Canaan.
know, just Westman, you know, the reality is.
Well,
we'd like to get.
other towns.
The Weston gave 25,000.
No, I'm talking about the people that are being referred that's the.
Some people are paying directly.
Yeah, they're paying directly.
Right,
That fee outside of New Canaan has dropped by Silver Hill, right?
exactly.
And yet we're offering to give them the exact same amount of money.
There's a critical mass they need in order to be able to price.
I'm not disagreeing with that at
If we
all.
bring in the 2 other towns, that would help, you know.
100,000%.
Yeah. And we hope to bring in 2 other towns. Wilton in particular.
Working on it.
Well, I think January 1st, you'll have that.
Maybe.
Yeah, and here, Ridgefield just had it.
And that's discussion now is Westport more than anybody else, unless Ridgefield wants to put.
Darien not gonna get on board?
So I have a motion on the table anyway, so I'm gonna do that.
Second, Russ's recommendation is 7% increase on the community dues, the 5 and 5,000, 2,500. But keep the focus on the big guys. 7% assessment, sounds fine, kids in crisis.
And what are the 6 agencies that are in that group?
The 6 agencies identified domestic violence. Crisis.
That's the answer for an increase, so why give them an increase?
If they ask for 10, And we're
Usually
giving
don't
them
give them more than.
I understand that ascertain, but I just looked at it as number of cases that are, New Canaan is referring to domestic violence have gone in, and I understand they only asked for 10. So maybe that one we don't increase it above that.
Would you then add it to like elder house? Like the increase that you would have given domestic violence?
Exactly, so it would be those types of programs that are out there that inflation does matter, even maybe the motion should be changed that, you know. Only for those that we have put the recommendation less than the request.
Okay, but I thought you were saying you wanted to be New Canaan focused and
I did.
Service.
Yeah, so those were the 6 that I identified, right?
He's saying.
Domestic violence crisis, Get About, Kids in Crisis, Meals on Wheels, New Canaan Cares, Silver Hill. Right, are those the 6 that are predominant, New Canaan?
What about you? Okay.
Is there a guidance on this budget as far as cost of living and annual increase or something? In many years, we've been told, it's going back, we've been told we had 180 last year, you got 180 this year. There's a lot of years where it was 0.
Yeah.
Right.
Increase.
Is there a number that's higher than 0 this year in terms of a inflation adjustment or cost of living adjustment?
Well,
or
Medicare-
finance?
The social security has gone up 7%.
Tom, are you asking for the Board of Finance
In other words-
recommendations? We were advised to try to stay under 3% increase
Okay.
for our overall budget, but I don't know if this pertains to that.
Okay.
Yeah.
I'm just gonna note,
Okay.
you're fully funding Meals on Wheels also, their request level.
Yeah, well, the request level was 65, we're, what was it? We're asking recommending 50.
We're talking about Meals on Wheels.
5,000.
That's right.
I'm sorry.
Meals on Wheels.
So I-
Yeah,
Cars get it, okay.
they do deliver the meal, get them,
Yeah,
which they do wonderfully.
I retract my motion. That helps.
Are you trying to make
For the second
gray
time.
hair there? Sue?
I know,
We're doing okay so far.
okay,
3 minutes.
3 minutes.
motion.
So, there's nothing glaring on these grants that we want to move in one direction.
As I said, this is a proposal, this is a request, this is what I will advocate for at the 3 meetings, one with Board of Selectmen, Board of Finance, and Town Council. So what you choose today is what I will advocate for at these 3 meetings.
The kids
I
in
know
crisis,
that just not there, right? So, yes.
Yeah, I have to substantiate it, which makes sense, you know, and I feel we have strong arguments for this.
Oh, yeah.
All right, another motion, please.
I'll make the motion as approved as submitted. I think I've warmed the hearts of the nonprofits that are looking to this program.
Ross did advocate for.
Yeah.
Harrison.
Just got about too. Definitely better review this book.
Ooh, too late.
you on the board there?
I'm ex officio. I'm ex officio for Schoolhouse and for Get About. I'm just there as on behalf of the town.
Well, the request is 65, we're giving 50, so what's the judge?
Is there a reason for the increase from 47 to 50? Is that too much?
Gas, and then when they have to outfit a van, they purchase a van, but then it has to be outfitted, ADA compliant, things like that, so.
Did you go to their fundraiser?
I did not.
It was you, because,
It was unbelievable, it was like a whole new crowd.
so that's why I'm a little.
Set money is like,
No, they're doing very well.
wow.
Great.
When you do that, that's pretty cool.
Well, they got young board members.
Yeah.
They
That's
made
pretty
it
good.
a point
Yeah.
to look at some, younger board members.
Right, we're gonna bring their friends in. and-
Bring the friends in.
No, they could.
I just want to say before you.
Motion by floor, second by 3 people. So move. That's. Next motion is to adjourn.
No, everyone was.
I just want to say before you adjourn it, thank you for your service, everyone.
No,
Move to
Thank
adjourn.
thank you.
And thank you.
Thank you.
What are you gonna do with all your free time?
Yesterday at Women Empowering Women, he had the greatest 3-minute speech. And I just have to commend you for it. You said you came into your campaigning with
Focusing on things like
Cell
self-service and roads and gas and then I realized human services was something I hadn't really thought about. It was really an important part.
and that was just very,
Yeah.
I would appreciate that. The commission was.
I remember when you mentioned Johnson Mission, you know, 5+ years ago, and attending a couple of these meetings to make sure I knew what I was getting into. I was very impressed with what they were doing in town. And that was pre-COVID.
Kevin's the one who brought in the health department, was never part of these
No,
commission
and
meetings.
how valuable you are to this.
And it was right before COVID hit, when all of it happened. Can I just make Harrison, one more comment? I emailed you all this morning, an email from our town planner, Sarah Carey.
Oh, yeah.
It's very important for all of you as residents to get involved with the P O C D. All the dates were listed, and I know housing always comes up. That's one of the topics on December 14th. So feel free to share with all your friends and help out with the development of the P O C D. It's great to get that.
Kevin, thank you for all your, everything you've done.
Yeah.
Yeah, I felt Kevin was one of the best things he's done lots of things out of it. Was the New Canaan urban assessment. Kevin was the prime mover, not only in terms of moving out the fund, but the idea, et cetera. So that's been a significant help to New Canaan and our joint town, so.
Thank you.
Absolutely.
Probably too, I mean, he was the CEO, but, you know, Jen and everything, what everyone did in this town.
Yes, we had a grand time together. We made it through.
Not really.
Grand time.
But no, Kevin worked just as many hours as I did during COVID. He was still here with me every night. Every Saturday, he'd come by and see me, so no, I don't think the town realizes how many hours Kevin put in through that and through these other things, like the urgent assessment program, so thank you. And thank you for supporting the health department.
Motion to adjourn.
Motion to adjourn.
Thank you.